Hello. Welcome to this edition of Ask the Vet. Ask away your veterinary questions. We'd love to hear any questions that you have related to animal medical care. Sorry, got something stuck in my hair. And I'd be happy to answer them for you. I'm the vet, Dr. Boden, and I'm glad to see y'all here tonight. So be thinking about your questions, but also it's Pet Appreciation Week. So, what do you love most about your pet? If you have a photo, please show me because I would love to see photos of your pet. You can comment below, let us know. Bonus points if you have any pictures because I love pictures of pets. Personally, I appreciate my cat. She loves to snuggle on her terms, though, not really on anybody else's terms. But really, all my animals are amazing with my kids, which I appreciate a lot as well. So it's just really great. So, hey, Helen, welcome in. Glad you're here. And glad everybody else is here too. If anybody has any veterinary related questions, pop them in the chat. But for today, I'm going to be, you know, talking about vaccines. They're so important. But before I begin answering questions and talking about vaccines, and while you're typing away telling me what you love about your pet, I want to let you know you can find all of Spay Neuter Network's events on their Facebook page. They have vaccine clinics, they have spay neuter events, they even have a message button, and they are pretty responsive. So if you have any scheduling or non-medical questions, go ahead and message them, and they'd be happy to answer those questions for you. And if you don't already follow them, click that follow button. We do Ask the Vet the first Wednesday of every month, and so you don't want to miss out on catching us in the future. So I'm going to pop over here. Yeah, I love their loyalty. Yes, pets are so loyal to us, and I love that too. I love that um, they love us through thick and thin. You know, they don't care if we're rich or fabulous or if we wake up on the right side of the bed every day. They just love us. So I agree, Helen. Okay, well, I don't see any questions yet, but if y'all think of any, just go ahead and type them. So personally, as a vet, I've been seeing a lot more parvovirus around this time of year. It feels like it's everywhere right now. Animals with poor immune systems are more likely to be affected by parvovirus, which is typically like kittens and puppies. So these both manifest primarily as GI signs. So we'll end up seeing diarrhea, vomiting, and appetence. And if you notice any signs like this in your pet, I recommend getting to the vet as soon as you can to have them checked out, especially if they're young, unvaccinated animals. Unfortunately, parvovirus and its panleukopenia in kittens is a deadly disease and generally requires extensive treatment. So that can include IV fluids, hospitalization, IV and oral medications, and other things as well. And so this treatment can be so costly, while prevention is pretty inexpensive. So I cannot say it enough, and I'll probably say it again, vaccinate your pets. And I'll talk about more about that in a minute. Fortunately, there's organizations like Spay Neuter Network that work at having low cost vaccinations for our furry friends. So we don't have to worry as much about the cost of that. So, uh, okay. Helen says, my hubby wants to know what to do when a dog has a fever. So it depends on how you're taking their temperature. I feel like dogs run warmer than we do, so we'll see them out even up to like 102.5, and that can be normal. It just depends on if they're showing any other clinical signs or of illness. Definitely keeping them in a cool place. You can put them in front of a fan. If they seem really hot, you can put alcohol on their paw pads to help them cool down. Now, if it seems extreme, like they can't catch their breath, they're having difficulty breathing, I recommend getting to an emergency vet as soon as you can. Unfortunately, this time of year, there is a lot of heat stroke in our dogs. And those temperatures can get up, 104 and higher. And so, yeah, and so you just want to make sure that if your dog has a fever, first off, how are you checking it? And then making sure it's under 1025. And if it is, then they're probably okay, but you can just give them plenty of water, help them cool off. So, and then Helen also says, what advice can you give a cat or dog if a snake bite happens with no medical help around? That's really hard. So if there is a snake bite and it's a venomous snake, we do worry about uh, lasting effects of that. Oftentimes, even with just bites in general, they can become infected, which they would need antibiotics. And so I'd be worried about not going for medical help with that. That's a good joke, Paul. Paul said he wants to know what to do when a dog has a fever, and you go to the store and get mustard because it goes good with hot dogs. Yeah, but back to your wife's question, Helen's question. Um, if there is a snake bite, I do urge you to seek medical care as soon as possible, just because a lot of that skin can die off, a lot of that tissue can die off, and the animal often can go into shock and they end up needing fluids, they end up needing more extensive medical care. So, I just urge you to try and get to an emergency vet if that happens. Um, Man, that joke is funny, Paul. Thanks for that. Okay, so I'm going to jump back into parvovirus. But again, if you have any questions, just type them in the comments. I'm happy to answer them for y'all. How can we prevent parvovirus and other contagious diseases? Y'all, I already said it. I'm going to say it again. You know what I'm going to say? Vaccinate your pets. So many diseases in our dogs and cats are preventable with vaccination. So I urge you to have all your puppies and kittens vaccinated by a veterinarian every 3 to 4 weeks from about 6 weeks of age until they're 20 weeks of age. For puppies, that's with the DAPP or DHPP or some iteration of that vaccine. And kittens, this is the FVRCP vaccine. The reason we vaccinate at that interval in that age range is because when babies are first born, they get antibodies from their mom through her milk. And so every animal is different in how when they lose those antibodies, how long it remains in their system. So usually that is between 6 to 20 weeks of age. So that's why we vaccinate every 3 to 4 weeks during that time. We want to catch them at a time where they no longer have their mom's antibodies, which block the vaccines. And so we want to vaccinate them against parvovirus. So they'll be protected against that illness. So, uh, okay, can deers be kept as pets? What yearly vaccines would deer need? You're moving to the country. There are people who have deer out in the country, and I don't think you can keep wild deer. I think you'd have to buy like a domesticated breed. And honestly, I don't know what vaccines they need. I've never worked on deer before. You could look for a cervid vet, that's CERVID. I don't think Spaniard or Network does anything with deer either, but I know you do need taller fences because they can jump over the regular fences. And then Helen also asked, could I keep an antidote for venomous snake bites? I don't think they're available outside of the veterinary clinic. Also, they're so expensive that if you just kept it around, it may end up expiring, not working. Hopefully, your pet doesn't get bit by a snake, but then that's wasted money for you. And so I I really don't know if people can buy it though, or if you have to know how to administer it a certain way. I've only used it on emergency clinics. Okay, and Maribel says her Chihuahua is 9 years old. Um, he's 9 years old. Wow. And I believe it says, can he be operated on? I can speak some Spanish, but maybe not a ton. So hopefully you understand what I'm saying. Hopefully I understand what you're saying. He can be operated on. There's not really a time where a dog becomes too old to have medical care done. If he needs to be neutered, I strongly recommend he gets neutered, just because with older age, there can come more diseases in intact male dogs. And so you can see like prostate issues or prostate cancer, testicular cancer, um, even some things like that are just gross, like their booties can swell up. And so I do recommend having him neutered. And if you need more clarification, please let me know. Oh, Facebook has this little translation button. Yes, okay. He's 9 years old and can he be operated? Sorry. Um, yes, he can. If he does have another disease or another issue, um, that would be something to talk to your veterinarian about and see how that can be addressed, and how he can safely undergo anesthesia. So, um, y'all keep the questions rolling in or the jokes. I'm okay with jokes too. I really like jokes. So going back to the vaccines, what other diseases are we protecting against when we get the FVRCP vaccine and the DAPP vaccine? So with the dog vaccine, DAPP, we're protecting against distemper, adenovirus, parvovirus, and parainfluenza. There was a distemper outbreak in several major US cities, or Texas cities and US cities over the past few years. Distemper is just a terrible disease. At first, you see GI signs, and then the virus invades brain tissue, leading to neurological issues, which can culminate in focal spasms to even seizures to death. And so, since these diseases can lead to death and they're so easily preventable, again, recommend you get vaccines. Which actually, Helen, there is a rattlesnake vaccine. And I don't know if you've looked into that before, but that might be something to consider getting for your dogs if you're more worried, or and your cat, if you're more worried about them being bit while y'all live out in the country. So something to look into with the rattlesnake vaccine. But for cats, the FVRCP vaccine protects your kitty from 3 highly contagious and life-threatening feline diseases. So that's feline viral rhinotracheitis. What a mouthful. It's also known as feline herpes virus, and it's a cat-specific herpes virus. There's also calicivirus and panleukopenia, which we talked about before, is like the parvovirus of cats. And so the rhinotracheitis and the calicivirus are respiratory illnesses, and calicivirus can lead to ulcers in a cat's mouth, making it difficult to eat. And these diseases just can make your cat really miserable. And a lot of times they just sit until your cat gets stressed and then they flare up. And so, again, really great to get your kittens vaccinated against rhinotracheitis, calicivirus, and panleukopenia, so you don't even ever have to think about those illnesses. Unfortunately, a lot of cats do have herpes anyways, but it's something that we can manage better if they are vaccinated. So let me check, see if we have any more questions. Another joke. What do you call a pile of cats? A meountain. That's good. I like that. Okay. Oh, my vet said that only 7 years old and under, already 9, is at risk of dying from a stroke. Oh, wow. Um, I wonder if your Chihuahua has other issues going on in their body, but generally there's not a cutoff for a time that's good for spay or neuter. I know some high quality, high volume clinics won't do it over a certain age just because they don't have uh, necessarily the resources to do all the blood work, x-rays, make sure the pet is completely healthy to undergo anesthesia. But I'd still recommend talking to your veterinarian, seeing if there is a way that he could undergo anesthesia for a neuter, because it is really important that our pets be spayed and neutered, even when they are later in their life. Um, and 9 is actually not that old for a Chihuahua either. Chihuahuas, they want to live forever. So, okay, I see a question from Miss Bonnie. Hi, Bonnie. So her cat has CKD and he stopped eating and drinking as much the last 2 days. Just went back, uh, okay, from a 2-hour appointment in the vet. Oh my gosh. Did blood work and a sonogram. Blood work came back totally normal. I was told the CKD cannot improve. Could blood work done in-house be inaccurate? And they've always sent out the labs before. So the blood work was completely normal, like even for the kidney issues, or were they just not finding other issues on the blood work as well? Because yeah, CKD, there it does irreversible damage to the kidneys, and so as those parts of the kidney stop working, they're not going to come back. They're not going to regenerate. So everything was normal. I would be skeptical, honestly. And so, if they offered to send it out, I would see if they could. Hopefully, they got him something to stimulate his appetite, and to give him some fluids, at least under the skin, but maybe even beyond that too. Um, and so sometimes if the machines aren't calibrated correctly, we can see discrepancies on the lab work. Um, but most in-house chemistry machines are pretty accurate. So I would be, yeah, they did okay. They did the fluids and the appetite stimulants. Um, yeah. So I mean, that's really strange that it came back totally normal. And hopefully they had something else uh sent out, had some blood left over, but um, did they find anything on the ultrasound for your kitty? And while I'm waiting for Bonnie to respond, Helen says, where can we get CPR certified for dogs and cats? And can you all offer this? I don't think Spay Neuter Network offers it currently, but it is something that is available. I know it's available to veterinary teams, and I'm pretty sure there is pet owner courses out there. Um, and that the name escapes me right now, but I think that's a really great idea. If you feel like your pet's ever going into arrest. But I will tell you right now, Helen, CPR is so hard. I've I've gotten an animal back once and they immediately died afterwards. And so it's not something that I feel like in TV shows and movies they show them like doing CPR and everybody comes back to life, but a lot of times they don't, in medical settings. And so I appreciate the thought of it, but it is something that's really difficult to bring an animal back to life. I feel like I've only heard of one friend ever actually doing CPR and getting an animal back, and they stayed alive. So, um, yes. So, okay. Bonnie said they didn't find anything on ultrasound. That's really strange. Have you been to a specialist about your cat? There's internal medicine specialists. If you're interested in something like that, you could request a referral. Um, yeah, I would call them first send out, but um, possibly if you could see a specialist, that might help knowing what to do. But a lot of cats with kidney disease can be managed in clinic. And so if everything was completely normal, I don't know. I mean, that's really strange. Yeah, you're welcome. I mean, I hope your kitty does well. Um, Kidney disease is so hard. Okay, so Eris said, "Hi, my dog was diagnosed with a mass. They said it's cancerous." One of my children that's wanting to join. Okay, they said it's cancerous. It needs to be on medicine. Do you know of a clinic where they don't charge that much? So the SPCA, but generally they do more wellness things. And then there's also, if you're in Dallas, sorry, I'm not sure where you're located, but if you're in DFW, there's also low cost pet vet, I believe in Irving. And then there's also Chew, which is CHEW off on the Hill Lane. Those are the ones I know of that offer lower cost care, but I don't know how long they're booked out. And it just depends what kind of cancer it is and what your yeah, Helen, she knows about Chew. They're really great and they do a lot more than just wellness. But we have a very important need for our wellness as well. So I'm sorry your dog has cancer, and I hope whatever medicine he gets on helps him out. Okay. Well, y'all ask me any more questions that you have. Um, I'm going to go over side effects of vaccines. Generally, most dogs and cats don't have any side effects from vaccines. There can be some soreness at where they got the injection, just like, I mean, whenever I get a vaccine, my arm hurts for like a day or two. And then they can also feel like a little off or down for a day or two. But in the case of more severe reactions like swelling, vomiting, diarrhea, difficulty breathing, hives, please go to your veterinarian or emergency clinic. Once you know your dog or cat has vaccine reactions, make sure to always notify the person that is giving your animal vaccines in the future so they can receive medication ahead of time to prevent any future reactions. So, oftentimes that looks like getting Benadryl prior to getting the vaccines, and that can help a lot. Oh, yeah. Okay, yeah. Well, so Eris, I would recommend looking into Chew. I know it's a bit of a drive, but they do a lot for animals in the area. And they try to be lower cost. Um, yeah. And then Helen also said there's Farmers Branch Animal Clinic um to try. So and then Helen asked what kind of dog food to use for itchy skin. There's foods called sensitive skin and stomach. It depends though. They might be itchy because of environmental allergies, and they could be itchy because of their food. The most common allergen in dog foods is chicken. A lot of people think it's grains, but it's not. It's generally they're allergic to the chicken. And so you can also try like novel proteins, but they have to be exclusively on that diet. They can't be getting table scraps, or chicken nugget from McDonald's or a hamburger or anything else. So there are hypoallergenic foods. So if you're concerned about your animal having issues with their skin due to their food, I would recommend, I say this a lot, but follow up with your vet. And they'll be able to facilitate a food trial. But if you just wanted to try something on your own, there's like Hill's sensitive skin and stomach. It actually might be sensitive stomach and skin. Um, and that could be something to try to see if that helps your pet. Um, there's also a lot of really great medications out there to help with skin and stomach or skin issues for itchy dogs, can provide them a lot of relief. So, great question. So I'm about to wrap up for the day. I think I got everybody's questions, but if I didn't, send me a little exclamation point. I told all the jokes. Hey, hey Rosa, Miss Yaya is in the house. Hello. Okay, Helen asked, what should I use to bathe pets with itchy skin? So you can use like a soothing shampoo. I feel like sometimes the oatmeal shampoos make them a little itchier. That's just been my experience, but there are medicated shampoos available, generally at the vet as well. And that can help soothe their skin too if they're having a bacterial infection on their skin. I know somebody who bathes her dog like every other day, and that's the only way she keeps the allergies at bay. So, um, I know I wouldn't be able to do that, but for some people that really works. So, okay, and then, ooh, Maria, great question. Uh, she asked, where can I get a low cost spay? Spay Neuter Network. um, this is them. It depends where you live. They do have clinics in Fort Worth, Dallas, Crandall, and San Antonio right now, and they are great at getting you a lower cost option for spaying and neutering your pets. And then I got a question from Hernandez. I have dogs I haven't fixed. They wake up at 3 a.m. to go pee. Is it because they're not fixed? Others are fixed and never had this issue. Um, Ooh, you have 8 dogs. That's a lot of dogs. Um, I have my two. That's enough for me. Uh, she just hasn't fixed these two. Okay, and then she's asking about raw food. Okay, Hernandez, it could be because they're not fixed that they want to go mark something, but I can't guarantee for sure that they won't wake up at 3 a.m. Just because they do have more testosterone in their system. So once they're neutered, they may still want to go outside at 3 a.m. So I would follow up with your veterinarian and see if there are any other issues with your animals that could be causing them to have more urgency to pee. And it might just be a pattern that they've gotten into, honestly. Um, so like I don't wake up in the middle of the night to go to the bathroom, but every night my husband does. So I don't know why that is. Of course, he's not neutered, but I think there can be something about a pattern of that for the rhythms of their life. And then about raw diets, I do not recommend raw diets. They're unsafe to handle. They can cause a lot of diarrhea in you and your dog, unfortunately. So I just, yeah, I don't think raw is okay. So great questions. Um, okay. Yeah, y'all have a lot of dogs and cats. Um, okay, and then Maria, that's great. You live in Rockwall. There is a clinic on Buckner, Spay Neuter Network clinic on Buckner, in Southeast Dallas. So you should Google them, check them out, send them a message on Facebook, and they can get you situated. And Helen, you got a lot of dogs and cats. 4 dogs and 7 cats. That's a lot. And then Liz says my apartment complex has a homeless cat. Oh, he has a broken leg. So you could call, depending on where you live, you could call the city that you live in, and hopefully they'd be able to, the shelter would be able to get him fixed, like fix his leg, probably also neuter him if he's not already. Um, that's really sad though. Possibly he would need an amputation of that leg, just depending on how bad his broken bone is. It depends on how long it's been like that. So, if you want to call your city and see if they can help, and if it's bad enough, you know, he might not make it, but um, it's really a really great thing to think about. Um, yeah, and I don't know how much it would cost. Spay Neuter Network doesn't do orthopedic surgeries like bone repairs or amputations, but you can call around to clinics and see what's available. Oh, he has an infection in his eye. Yeah, so many of our kitties out in the public have infections, eye infections, and nasal stuff. That's why I was talking about vaccines. It can help prevent a lot of that. So, Helen loves Spay Neuter Network with all the affordable or free vaccination clinics, and they also spay and neuter your pets. So, yeah, you're welcome. Uh, yeah, yeah, great questions tonight. I really appreciate it. I'm going to wrap up for the evening. So we'll be back next month on the Ask the Vet. Again, like Spain Internet Network's Facebook page so you can keep up with all their events. They have free vaccination events coming up, and just regular vaccination events. And they have really fun things too going on. So be sure to like their page and follow along. The next one, the next Spay Neuter Network Ask the Vet should be on July 5th at 6:30 Central Time. So be there or be square. And yeah, thanks for tuning in, y'all. I appreciate I appreciate everything. Y'all are awesome. Okay, I hope you guys have a good night. Bye.